Hello, 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 testing one, two, three. Uh, can you hear me? Am I audible now? Okay, all right. Okay, so let's start again. Okay, so what I was telling was, welcome back. This is Forearm Part 1, right? Session 9. Okay, so over here, say this forearm is such a topic that there'll be lots of muscles, very small size, right? So many names. But once you understand the whole mechanics of it, it becomes quite easy. But one thing is very clear that you need to revise it. So, so this is the reason by the time when we'll complete the topic, back to back, within 5 to 7 minutes, we'll revise the whole topic again. Right? I have put some new images, so it will be much easier for you to revise it. Right? Okay. Another interesting thing about forearm is that you need to remember that there were those four nerves, right? Radial nerve, musculocutaneous nerve, median nerve, and the ulnar nerve. Two nerves would disappear, right? They will be giving all those cutaneous supply, and only the median and the ulnar nerve will be proceeding forwards, all the way going towards the palm, that is the hand, and then they will be completing their duty, right? So that's how things would go. As our normal pattern, we'll be starting with very much simple, that is the bones, right? So even though you know it well, so we'll start writing it in short, right? This is humerus, that's radius, this one is ulna, you know it so well. These are the all 8 meta. These are the carpals, not metacarpals. These are the carpals, right? These are the carpals. Sorry, these are the carpals, and these are the metacarpals, and then there are phalanges, right? All those metacarpals, phalanges, etc. that will take in the hand when we'll be discussing hand. Our today's portion that would be restricted to this much area, right? Okay. So here we say that's humerus, right? So this area, right? This entire area, that's the condylar region, right? That's the condylar region. This will give you very good link with what we discussed last time, right? Then this was our articular area, right? That is the articular area. And here is the radius, that's the ulna, right? So I'm just writing it in short. And then that's the body of ulna. So this is the body of ulna. And that's the proximal part of ulna. Similarly, this one is the proximal part of radius, and that's the body of radius, right? Pretty easy. Adding something more to that. Okay. Parallelly, this way we'll be learning the even the bones also, right? We are not making it very complex, just we are adding one by one the things. So over here into the radius, right? Into the radius, this side is our lateral side, and immediately we'll see. I just zoom it. Yeah, right. I just zoom it, and if we watch for this this border, right, all the way, right, if you see, it is going and it is forming, this is anterior, right? So that's why that's the anterior border which is going towards the lateral side, but in the process it will be forming this lateral surface, correct? That would be the lateral surface, and we are dealing with radius. Okay, on the ulnar side, this is clean, right? This is absolute anterior surface, right? This is anterior surface of ulna, right? Okay, let's move further. This is the joint which will be watching it in more detail because all the muscles, they will be connected over here. Okay, we pick up those two cute names, right? One which was capitulum, right? Capitulum. And this is that pulley like, and that is trochlea. Good. Rest of the structures, well, this one is coronoid process, right? Coronoid process. And over here, yes, and over here, this is ulnar tuberosity, correct? That is ulnar tuberosity. If there is ulnar tuberosity, here is the radial tuberosity also, right? So this is ulnar and the radial tuberosity. So these are the two important tuberosity. Rest is all like, say this is neck of radius, right? This is the radial side, this is ulnar side. Okay, right. Deliberately I'm not touching this portion, this, because there will be association of one muscle, right? Just keep in mind it is supinator, it is supinator fossa, right? But in more detail as it arrives when its turn would come. Okay, starting with our muscles. Now the pattern which will follow in this case is, right, we'll go from deep to superficial, right? So we'll start with absolute depth. We'll keep on adding one layer by one layer, and then we'll come up to the topmost layer. Then once again, we'll start removing those layers and we'll reach back to the bones, right? So all the way to bare bones. Two, we'll keep on adding the layers and we'll reach to the full structure. So this way, one way journey, and then we shall go back, right? Same thing we'll do on both the sides. So first we are watching the anterior part of the forearm. When we say anterior part, so actually this is a flexor component, right? Flexor. So we are dealing with flexors. And when it will go to posterior, yes, that would be the extensor component, right? And once the muscles are ready, then we'll start putting the vessels, and then finally the nerves. Nerves part is very, very easy. Those nerves, right? There would be one figure which will look like so horrifying, but actually the moment you analyze it, you'll find it is nothing. It is so simple, right? And even in case of arteries, right, I'll give you a very good key. So what you do is, on that page we'll add a new page and we'll draw the whole thing, right, in our own language, so that once you see that figure, you'll be able to recollect every branch, you'll be able to recollect all that collaterals, right? You talked about that someone was unable to understand those collateral circulation, right? Collateral is nothing. Today also we'll see that how those collaterals they actually occur, right? And the elbow, you need to draw along with me. So the moment you draw it, you will be able to understand it crystal clear, right? That's why we'll draw today also. Okay, so let's start with the very basic muscle, the first muscle, and that's the muscle which we said that right now we are keeping it. Its turn came so fast. This is the supinator muscle, right? Supinator. And we said king's pronate beggars supine, right? King's pronate. So this is pronation. This is pronation. Supination is this, right? That is supination. So first muscle, easy to understand. What it does supination, right? Done. So this is good. If he is supinator, so then there has to be another muscle which should work in exactly opposite direction, right? So that is over here. Its shape is so typical, right? It is quadratus shape, quad shape, right? This is a quad shaped. This quad shaped. So no harm in giving a name, because that's what we have been doing right from the beginning. Sorry, we write it here, right? Quadratus, And what name should I give me? Because this is the, as per the shape. Well, it is a pronator, right? So why not to give it a name? Pronator quadratus, right? So this is pronator quadratus, and that one is supinator. Easy, easy, right? And this is at the deepest layer. This is at the deepest layer. The first thing, right? Now let's add something on top of it. And the moment we add it, boom, so many things, right? Well, actually, yes, right? So many things. So we see it in a very different way. Watch for this muscle. Can you see this? Right? This what I'm telling you about. Yeah, that is what we saw, supinator, right? That is supinator. Okay. And can you see this muscle over here, right? Which would be falling like this. Yes, that's the muscle. So this is where it creates the reference in our brain that where exactly are we? Because say in case of forearm, yes, good afternoon. In case of forearm, it is very easy to get lost. That where exactly are we? Because layers would be coming one after the another. Right now, I'm not telling you, and even I'm forcing you that yes, you remember all those muscles, right? No, you don't have to remember. Just see, just understand, right? So that's right. That is the pronator quadratus, right? You don't even try to remember all these muscles as they will come, right? Just see that how they are arranged, right? The visual impression. I just want to give you a nice visual memory because remembering names, it is so easy. It is so easy. It's a matter of 5 minutes, right? So, okay. Now, first thing first, the what we really see, we just see that yes, this big one, and then there is some one more muscle. These are the two muscles which we can see that they are lying exactly on the top, right? Okay, over here, right? All you need to see is that which hand are we dealing with? Are we dealing with the right hand or we are dealing with the left hand? We are dealing with the right hand. So this person, this gentleman is standing in front of us with his right hand. So if this is his right hand, that means here is his entire body, right? So this part is lateral, right? Orient very well properly, right? This part is lateral. So this part is radial, right? This is radial, right? So obviously rest is medial and ulna. So now I can remove this so that we can write. Okay. So this is medial and ulna is over here. All right. So first thing first, on the radial side where we take the pulse, on the radial side, there is thumb, correct? There is thumb. And this thumb is called as pollicis. Pollicis, right? Pollicis. Just remember, because all the muscles they will be named as per this pollicis. They will not say that flexor thumbalis pollicis, right? They will not say that. It would be like say flexor thumbalis longus, flexor thumbalis. No. It would be flexor pollicis. Fine. So now we can see that. Watch this area. Watch this area. Now this is here. Yes. So this is 1, 2, 3, 4, 5. Yeah, this is making sense, right? Because when the person is standing, so that means this portion would be going towards the thumb, and these will be going towards all the fingers. Good, right? Okay. So with that respect, this is this is the flexor chamber, right? Flexor one, because we are dealing with flexors. So now we'll write from this point onwards, F means flexor. So flexor, they both are flexors. And this is for all those digits. So we'll add flexor digitorum, right? and rich muscle, है ना? Rich muscle, thick muscle, so much. So whenever things are rich, there is so much. So we say it is profound, so much. So that's why it is profundus. It is profundus. So this is flexor digitorum profundus. Now onwards, we'll write only FDP, right? So that way, I'll keep on speaking, but even when you'll practice, even at the end of our today's session, you'll be saying like flexor digitorum profundus, but in the practice, you'll keep on writing FDP, right? Or FPL that way. Okay. For thumb, yes, this is going towards thumb, so we'll surely call it flexor pollicis. Pollicis. It's a long one. So it means, will there be any shorter one? Yes, there would be a shorter one muscle also, right? So that's why we'll call it this as a longus. Longus. So here is flexor pollicis longus. That means we have got now two muscles which are well known to us. So supinator and pronator quadratus, right? They were deepest. On that we have put two muscles, two big muscles. One is big, one is long. That is flexor pollicis longus, which is a long muscle, and flexor digitorum profundus, which is rich muscle, right? So next one. Now adding something more to extra, more to that. Always try to identify that, can we really see that which are those muscles, right? Yes, this is supinator, so we'll just write in short S. Do we know this? Yes, we definitely know this is pronator quadratus. And on top of it, do we see this one? Yes, because there are 1, 2, 3, 4 slips going. So that is flexor digitorum profundus. Very nice. But we see that there is a big gentleman who can be seen straight away, right? This one is flexor. Now here is a new name coming up. Flexor carpi radialis. Flexor carpi radialis. Now why such crazy name? This, just understanding this one name will give you a very nice idea. And that idea is that in case of forearm, there will be two types of muscles. One muscle would be which will be going towards the wrist, and its function is just to move the wrist, flex the wrist or extend the wrist. But that's it. Their functions are over. So they all will be landing on these carpals, right? They will be landing on those carpals. So they'll flex the carpals. Will they be making any movement in the hand? Nothing. Not. There'll be another group of muscle, right, which will be going all the way, and then they will be going towards the fingers, right? That is, they will reach to the digits, and then they will be playing role into the movement of digits. So those muscles which are working only on the wrist, right? Very easy to identify. Their names would always be carrying the carpi. Carpi means carpals, right? So carpals, they are into wrist. So it means they will be dealing only in the wrist movement. It means we can very safely say that flexor carpi radialis is a muscle which will be inserted on the radial side, and it is the powerful flexor of the wrist joint. What's the big deal? Because name itself has told everything, right? So flexor carpi radialis, just for our understanding right now, we are writing that it is a wrist flexor. Wrist flexor. You got it? Right? Nothing big, right? The names itself, they are so simple and so easy that that name itself is telling us that what it will be doing. But just for our understanding, we are writing it is a wrist flexor, right? Flexor carpi radialis. Came from carpals. Carpi means carpals. Okay. Otherwise, all those rest of the muscles, they are known to you, right? So this is, in fact, this one also, it is flexor digitorum profundus, right? Because flexor digitorum profundus, on top of it, it is this flexor carpi radialis, which is lying. Okay, let's add few more muscles. Here it is. Now things are becoming more interesting. Okay, this is, right? Now I'll start writing in short. flexor carpi radialis. Why flexor carpi radialis? Because it is going towards the radial side, right? It is going towards the radial side. That means it is going laterally. Okay. And this one is also easy, supinator, right? This one is pronator quadratus. Okay. Almost since three figures, one muscle which has appeared and we are not even talking about it. And it is this muscle. It is so big, so prominent, so important, and still we are not talking about it. Right? The reason behind it is that actually the muscles which are on this side, right? They all are flexors. The muscles which are on this side, right? They are extensors. They are extensors. So actually it looks like that, okay, this is front and this is back, but things are not that clearly defined. They are at an angle because your forearm, it can move at many of the angles. So this one, which we are ignoring and we are not even talking about it, it is such a long muscle. And now we have said that it is an extensor muscle, right? Let's create the name of it, right? And it would be so easy to name it. So I told you that this is the extensor muscle. So I'll write extensor. Now this extensor muscle is a powerful, listen carefully, it is a powerful wrist extensor. It is a powerful wrist extensor. So can I write C? So extensor carpi. It is on which side? Radial side or lateral side? Obviously, this is the radial side, right? This is the radial side. So can I write R? And see, this is so long all the way, right? It is going. So let's call him L. Longus. That's the name. It is extensor carpi radialis longus. Pretty clean, right? So that is extensor carpi radialis longus all the way. And that's why any of the muscles which will be added on now onwards on this side will not talk about it. In fact, not much will come, right? But the muscles which are into our flexor part, first we'll talk about it. Once this part is clean, then we'll go to the extensor component. And for extensor, you have to actually change the entire orientation because this is like we are watching from anterior side and then we'll watch it from the posterior aspect, right? That would be the thing. No worries. Everything would be properly oriented. So flexor carpi radialis is good and the flexor digitorum profundus, right? Profundus means big, bulky, big muscle. So even when you'll do the dissection, you'll be able to see the power of that muscle. Okay. Now adding more. Now see. So over here, see, this is a newcomer. This one was already there, right? This is a newcomer. And then there are deep muscles. Suddenly things are looking a bit complicated. To see this, to understand this thing, I've just removed it. We start with the first small muscle and then step by step we keep on adding in the form of 1, 2, 3, 4 and 5. Right? We'll just see these 5 muscles and we'll be going from our little finger towards the thumb, right? So we'll write it like finger or we'll say little finger side to thumb, right? Well, we can always say that we'll be going from ulnar side to radial side, but somehow it unnecessarily complicates. When we say, okay, going towards thumb, it becomes mentally you feel it relieved, right? Okay, so starting with the first one, right? And these are the muscles which are known to you. Supinator, and this is pronator quadratus, and this was, right? You know the name. I'll not write it. I know you know it. Okay, all right. Yeah, extensor carpi radialis longus. Okay, so here is the first one. This one is the first one. This muscle, right, which is going all the way, right? This is the way it is going, right? Let's say this is one, this would be two, right? This would be three, and then as it comes. Now, see pronation, pronation, right? Pronation. For pronator, there is already a quadratus, but this is a straight muscle. There is another straight muscle, and this is pronator teres. Pronator teres. So this one, this first one, this is pronator teres, right? The next one, yes, it is reasonably big muscle, right? And this is, I'm telling, right? And you know this. This is flexor carpi radialis, right? We have already seen that. Now there is one more muscle. This muscle is palmaris longus. Name itself is telling it is going towards palm. Now this muscle is present. It not present is not present in everyone. Right? Maybe 10 to 12% of cases it is present. In otherwise, it might not be even present also. So slowly and gradually, it is disintegrating. Right? It is like a vestigial organ, like appendix. Right? So that is palmaris longus in case if it is present. Now when we said that our rule is that if there is only one flexor of the wrist, what name would you give? Whether it is on radial side or ulnar side, you will say flexor carpi. Bas khatam. Why should you say radial or ulnar if there is only one muscle? If there is only one muscle called say extensor for wrist, on radial side, so you'll say it is extensor carpi. Well, if it is on radial side and medial side, radial side and ulnar side both, so then you might have to say extensor carpi radialis, right? Over here we said flexor carpi radialis, so that means there has to be another muscle who is doing the same work, and that muscle is over here, right? And that muscle is flexor. This is number 4. This is flexor carpi, and this time it is ulnaris. Now it makes sense that why we said flexor carpi radialis, because this is going towards the ulnar side, and that one is going towards the radial side. So this and this, right, they make a pair, one going on radial side, another going on, say, ulnar side. So that is done, right? Good one. Okay, then there is one more muscle. It is this one, this one. Now, to see this muscle, right, we'll have one more image. We'll have one more angle to look at it. For before we proceed for that, right, to remember this, just make your hand like this, or let me show you like this. Okay, like this. This is a method to remember these 4 muscles. Once you have remembered these 4 or 5 muscles, just by this, if once you remember these 5 muscles, it improves the concept. So when you do like this, right, and then put your hand, right. So it's like that's my elbow, and that's the hand, and I put my hand like this, right? I put my hand like this. Remember, the thumb is under, right? Thumb is under, and then so it's this is the position, right? Now the first finger, right? It would be arranged obliquely, right? Like this, right? And that is pronator teres, right? Sorry. See, the first finger second finger, third finger, fourth finger, and thumb is underneath. Got it? Okay. So when we put it like this, so first finger is pronator teres, right? Ankle. Okay. The second finger is going towards the radial side, so it has to be flexor carpi radialis. Flexor carpi radialis. The third finger, which will be if you put the hand like this, so this third finger will be going straight away to the palm. So that is palmaris longus, and this little finger that would be almost parallel to ulna. So that is flexor carpi ulnaris. Right? See, make your hand like this. Right? Right? Like this. So if you are doing it on your with your right hand, then you have to put it on left hand. But because this is the right hand which we are understanding, right? This is right side. So do this thing with your left hand like this, right? Like this, and see, that's the forearm, right? And put the hand like this, right? Say like this. Thumb is underneath, and this is how you put it. So now this first finger, right? This first finger, this is pronator teres. This is pronator teres. Okay, because this is at an angle. Keep watching the figure also, right? So over here, this one is the first finger. So that's why we can write this is like 1. Okay, so that is the pronator teres. So if I put my, so this is pronator teres, right? At an angle. Okay, the next one, the second finger, right? It is this muscle, this, which is going towards the radialis. So this second one, so just 4 fingers, this second one, it is flexor carpi radialis, right? Then that's the third one, this third one is going straight to palm, right? It is going straight to palm. So that is palmaris longus. And last finger, this one, last one, it is almost parallel to ulna, correct? It is parallel to ulna. So that is flexor carpi ulnaris. So we have learnt these 4 muscles, right? Just the orientation will give the entire answer, right? So this is pronator teres, flexor carpi radialis, then palmaris longus, and the little finger, that is flexor carpi ulnaris. And the finger which is underneath, that means this particular muscle which is underneath, that is flexor digitorum superficialis, right? That is flexor digitorum superficialis. So obviously it will be going for the fingers, digitorum, right? So these are, and that is your thumb, which is underneath. Now is it clear? Right? When you do like this and you put it on your hand, immediately tuck, 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 5 muscles are over. Right? Any doubt in this? Because keeping this thing as foundation, as such, you have finished all the muscles. Right? All the muscles are almost complete. Right? Clear? Very good. Very good. So, if it is clear, which were the deep muscles? Right? Which were the deep muscles? 2 deep muscles. One was with respect to this flexor digitorum superficialis, it was flexor digitorum profundus, right? It was profundus. And then there was one more muscle in which thumb would say that I need a special muscle for this flexion, and it was a long journey, right? But still a muscle traveled all the way, and for the flexion of the pollex, that is thumb, that is flexor pollicis longus. So technically speaking, these five muscles, that is pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis, these are five superficial muscles, and your flexor digitorum profundus and the flexor pollicis longus, right? They are the deep muscles. Pretty clean, right? Okay, let's move further. At times, if you feel like there are so many names, just remember this hand, right? And then put the hand, and then the direction itself will give you the clue that yes, one is going towards the radial side, one is going towards palm, right? Another one is going towards ulna, right? So that itself will give you the complete clue. And another next is going for the pronator. Okay, see, right, to this we have added, and this is what, that is bicipital aponeurosis, correct? So that's the final layer, right? That is bicipital aponeurosis. Okay, it is covering what? It is covering this pronator teres. Yes, that was our first finger, right? So I'm writing one. And this one was what? That second finger, right? It was flexor carpi radialis, because see the direction where it is going. Yes, it is going towards the radial side, right? See here, it is going towards radial side. So that side. Wrist flexor, flexor carpi radialis. Flexor carpi radialis, so is now our old friend, right? We are watching it since quite a long time. Okay. And then there is a long muscle, but well, his app might not be present in all of them. So this is palmaris longus, right? Palmaris longus. Then on the radial side, on the ulnar side, this is flexor carpi ulnaris, right? So that is good. This big entry, this muscle is brachioradialis, right? Brachioradialis. But you will say this is easiest to remember because brachio, we know that it is the arm. This means that this muscle is coming on when you really move. Sorry. So when you move your arm like this, so then the prominence which you get, right, that is brachioradialis, because on your radial side from the arm it is taking the turn. So actually it is that muscle which is giving power, right? So this is brachioradialis, right? So just a small muscle which was supposed to be named over here. And then this muscle which is superficial muscle, but just underneath these four layers, four muscles. So that is flexor digitorum superficialis, right? So this is our hidden thumb, right? So I'll write 5, right? So that is for thumb. Well, you have learnt all the muscles, right? So let's see. We go back now, right? So first thing first, what we do, we remove this brachioradialis, right? So we just put a cross. So brachioradialis removed, which was over here, correct? Right? Just for the reference, watch over here. Yeah, right. This big muscle which was covering everything, so we removed it. Okay. Now we are going back, and we also removed that bicipital aponeurosis, right? Bicipital aponeurosis. So that is also removed. Chalo. Now so it is crystal clear, right? This is 1, this is 2, this is 3, and this is 4. So our first finger, second finger, third finger, and fourth finger, right? Regarding thumb, where is thumb? Thumb is just underneath, right? It is over here, and it is what? That is the flexor digitorum superficialis, right? relatively superficial. Superficial to whom? Superficial to profundus. So that's why that was deep, this is superficial. Though this is not very superficial, but it is relatively superficial to profundus. Right? True. So now, starting with first, that is, right, this one, it would be, it would be pronator teres, PT, right? We'll just write it in. Now we can take a liberty to write it in short, right? And then flexor carpi radialis. And then this is that present in say 10 to 13% of cases, right? So that is palmaris longus. And then we have got the flexor carpi ulnaris. And then the hidden thumb. Done. So these five muscles, so now very well clean to you. Okay, let's move further. Yes, yes, yes. Good, good. And what was the name? Just by the way, what was the name? Though it is not in means the topic right now, but what's the name of this one? This star. What's the name of this muscle? This one, this muscle. What's the name of this muscle? Yes, extensor. Yes, it is extensor. That's right. And it is extensor of wrist. So extensor. You said that. Right. Right. So it is extensor carpi. It is on radial side and a long muscle. So extensor carpi radialis longus. That's right. Good one. Okay. Keeping this same, we are now removing, say, pronator. That's right. That's right. We now remove, say, pronator teres. Right? Let's remove that. We removed that pronator teres. Just for the reference, we removed this. We are removing this muscle, this one, right? So that that portion is properly exposed. So pronator teres is removed. And one more muscle which is removed. As such, it is not so important. So we removed that palmaris longus, this one, right? Which was over there, right? So we remove the palmaris longus. So that has been removed. So I just write PL, that is removed. This gives us clear three important muscles which are vital. First one over here, and that is flexor carpi radialis. Going towards radial side, this muscle, now we know that this flexor carpi ulnaris is not that small, right? It is quite a big muscle, but because under the cover of that palmaris longus, it was looking so bichara, right? But it is a powerful muscle. So this is flexor carpi ulnaris. So that is also good. And this is one, this is two. We have already removed pronator teres. So this one, which is now seen so clearly, and it is going towards the fingers exactly the same way it was going for that flexor digitorum profundus, right? So that one is flexor digitorum superficialis. Done. Okay. And yes, this is extensor carpi radialis longus. This one is supinator. This one is pronator quadratus. Done. Done. You have answered all of them. Okay. We remove even flexor carpi ulnaris, right? So which was over here. We remove that also. So here flexor carpi ulnaris has been removed, right? So it has been removed. So this leaves to clearly this is like just a supinator, that is flexor carpi radialis, and this one, right, this one is flexor digitorum superficialis, and this is pronator quadratus. Excellent. Now we remove extensor carpi radialis longus, right? We remove that big muscle, right? See this one, right? So big, this one, that has been removed. So there is one another one underneath, but he is not as healthy as this one, right? Over here, this muscle is more healthy, right? Just now you see, now you see the fitness of this muscle, right? This was supinator, and this extensor carpi radialis longus, right, is more fit because he has to run for a longer distance. And there is a chota bhai of this extensor carpi radialis longus, but it is bit short. So, but it is doing the same function. So extensor carpi radialis brevis, right? So this is brevis. So this is ECRB. That's how we'll write, right? So you understood that also. And we could see extensor carpi radialis brevis because we removed extensor carpi radialis longus. True? And yes, that one is supinator. Right? Okay. We remove one more muscle. Right? Clearly it is shown that the big muscle which was covering almost everything, that is flexor carpi radialis. Right? It was, so we removed that also. Right? Because it was, see here, right? Both these big bosses, right? This one and this one, right? They are covering everything. We remove that. And this. So now we see those muscles underneath. Now see that this flexor digitorum superficialis, we can't say that it is a small and weak muscle. It is so powerful, so good, right? But it is relatively superficial. So this is flexor digitorum superficialis. Superficialis. Right? Excellent. And the muscle which is over here. This is, now we are coming to that, because just underneath this flexor digitorum superficialis, there would be flexor digitorum profundus. Okay, got it? So this is flexor digitorum superficialis. Underneath there would be flexor digitorum profundus. Flexor digitorum profundus, and this is flexor digitorum superficialis. And in the deep muscles, there was one more which was going towards the thumb, and that was long muscle for the thumb. So that was flexor pollicis longus, and that's the muscle flexor pollicis longus. Right, this one. And yes, this one is pronator quadratus. Okay, moving further. See, now this is your testing time. Right, let's take a test. Right. Very quickly, I'll just write down 1. This is 2. That's 3 and 4. You don't have to type the answer, right? Just 1 minute, right? Within 1 minute, just write down the answer in your books. I'll be taking several tests, right? And just within 1 minute, I'll write down the answer also. So you honestly check yourself if you have answered it correctly. Okay? So start. Fatafat. Just write down what is 1, what is 2, what is 3, what is 4. Don't write here. Don't write here. Because it happens like if you write it over here, then others would feel, yes, yes, I know the answer. And actually, they won't write it in their books. That's why I always insist, do write in your book so that even if you're wrong, but you'll not be wrong next time. Okay, so I think time is up. So this first one, that is flexor digitorum. You must have noticed it is superficialis, right? This one is a deeper one, that is flexor pollicis longus, right? Superficialis is superficialis. Just that's the spelling, right? No one would care much for the spelling, but we should be right. Superficialis. Flexor pollicis. Pollicis is Pollicis. Longus is longus. Right? Okay. This one, that one is supinator. You know that. And this one is extensor carpi radialis, not the longus, because longus was healthy. This is just underneath. It is brevis, right? So this is brevis, extensor carpi radialis brevis. Okay, one more, right? Oh, this is the, you will, as such, straight away you will give the answer, right? So no, this is not a question, right? So supinator, and this one is pronator quadratus. By the way, there is one more muscle which is just sitting over here, and this muscle is extensor pollicis brevis, short muscle, right, which is for the extension of the thumb, right? Anyway, we'll come to that, right? Right now, don't even think about it. Now let's add something to this. Let's add arteries, right? Arteries. So easy, so easy. Over here, it's what? Brachial artery, right? Brachial artery. This brachial, as it comes down, that's the radial and that's the ulnar artery, right? So brachial, it divides into radial and ulnar. Now, step by step, we keep on adding. From the radial side, this is radial, this is ulnar. From the ulnar artery, there would be one artery coming up. And which one is that? I'll just mark that artery only, nothing else, right? We are dealing with this. No, this is back. We are dealing with this area. Right? So this ulnar, it will be giving branch, and it is called as the common interosseous artery. Right? And it is this one. Right? So that is the common interosseous, this one. Okay. Then for the radial, right? This one is radial, and this one is ulnar artery and the radial artery. Radius is giving one branch which is going against the current, and it is going up, right? It is going up. So that would be radial against the current, recurrent artery, right? So we understood common interosseous and radial recurrent. So far easy. Yes, so easy. Right. Over here, this one is radial recurrent artery, right? And this one is common interosseous artery. And again, it is giving branch, right? We can see that over here, this one, there is a branch. So yes, that is the common interosseous artery. It gives two branches, right? One is the anterior and second is the posterior branch of this common interosseous artery, right? Of common interosseous artery. Good. Okay. Let's add still more things to this. These are what we have done, nothing but just we have added those nerves for your orientation, right? So the nerve which is over here, right? That one would be, you are right, that would be the radial nerve. Okay. Then this nerve which is coming straight away and just abruptly stopping. It is, you are right, it is musculocutaneous nerve. And this musculocutaneous nerve, it is said that its name musculocutaneous. So musculo, it will be supplying which muscles? It will be supplying which muscles? Coracobrachialis, biceps brachii, and brachialis, right? And what about this cutaneous? Yes, we'll see that. We'll see that. But name is telling cutaneous. Yes, exactly. And it is on which side? It is on the lateral side. Okay. It is on the lateral side. Very good. And it is cutaneous. Yes, so let's give a name, right? It would be the lateral cutaneous nerve of forearm. What's the big rocket science in that? Simple as that, right? Musculocutaneous is done. Musculocutaneous is done. Okay. Then that's the radial nerve. So what radial nerve was? Last time we said that this radial nerve will be giving one branch here and second branch will go all the way down. Right? We feel like that nerve which will be traveling so much, so it must be the deep one. No, in fact, it is other way around. This deep will finish itself supplying over here, and this superficial branch that will travel all the way till hand, right? So this is what we'll study in hand. It means radial nerve is also done. So radial is done, musculocutaneous is done, and then only two nerves are left out. So that is one which is in the median plane running, and it is the median nerve because it is the nerve which is running into the center, right? So that's where it will go. That is the median nerve, and the only nerve which is left out, right? That shocking nerve, right? That shocking nerve, then on the ulnar side, and that is the ulnar nerve, right? Ulnar nerve. So this ulnar nerve and the median nerve, they will be the nerves which will be supplying all the muscles from this point onwards, because musculocutaneous and radial, तो they declared that बस यहाँ से तो from will be giving only the those cutaneous innervations. That's it. So median nerve and ulnar nerve, they will be taking all the responsibilities, right? So over here, it's okay. See, now we can see some images. Let's do one thing. I'm adding one extra page, right? And that would be much convenient. Then we'll come back to that figure, right? You draw this along with me, right? You'll find it very interesting. So we are dealing with arteries. We are dealing with arteries. So we know first one, and that is the brachial, right? That is the brachial artery. Brachial artery gives one branch which goes posteriorly and it travels along with the radial. It is a deep branch, so we call it deep brachial artery. It is also called as the profunda brachii, right? So it gives a branch. So just draw it like this. It gives a branch. Right? Don't draw too big, right? Just this much. Yeah. So name it profunda brachii. Okay. This profunda brachii, right? It will divide. It will divide in two parts, and one was like this, and second it will be continuing. This one was called as the medial collateral or the middle, right? In fact, it was middle, right? Middle collateral artery, and this one, the second one, this one, that was radial recurrent artery, right? So far, okay. Now this brachial artery, it will go further and it will divide into two parts. That is radial and ulnar. From ulnar, there would be one artery. We saw that. Common intraosseous artery, this one, right? It is CIA. So that is common intraosseous artery, and it would be divided into, say, posterior and the anterior, right? So we have got posterior intraosseous artery and the anterior interosseous artery, right? These are the two arteries. We'll see these arteries, but first we are taking a complete proper orientation. Then from radial artery, screen is blurred. Let me check. Yeah, here though it is showing excellent connection. It should not. This anyway. If there is any problem with anyone else, just let me know. Otherwise, over here it is showing excellent connection. In fact, the speed it is showing is 137 Mbps, so there should not be a problem. Anyway, coming back to this, the one which is going up, right? So that is the radial recurrent. Oh, sorry, just a minute. We have to just draw it like this: radial recurrent and right. Okay. See, this is middle collateral, and we by mistake we wrote it radial. It has to be collateral, na? Right? Radial collateral artery, this one. And this is radial recurrent because it is going against the current. Correct? So radial recurrent artery. Here is they meet, and this is anastomosis. So there is anastomosis in the form of this profunda brachii, which divides middle collateral, goes away, this radial collateral comes, and it meets this the branch of radial, and it is called as the radial recurrent artery, and then they create this anastomosis. So this is one anastomosis. The next one is okay. The next one is from the ulnar side, two arteries they go up. And then from over here, this is brachial, correct? This one is brachial. From brachial, two arteries they land. So this one is superior. Okay. This one is inferior because relatively. So one is superior, one is inferior. Similarly, this is anterior and this is posterior, right? And they all form anastomosis. They form anastomosis. And what type? It is on ulnar side. So we'll call it ulnar collateral arteries. So all the names: superior ulnar collateral, inferior ulnar collateral, anterior ulnar collateral, and posterior ulnar collateral. Because this anterior and posterior, they are short. Immediately they form these anastomosis, right? So we have now anastomosis like this, 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 this. So we have anastomosis on radial side, we have anastomosis on the, let's say, ulnar side. These are the two anastomosis. Otherwise, the normal function is carried out happily by this, right, brachial, and then that brachial divides into, say, radial, and this one goes towards the ulnar, right? So it works happily, but these are the collateral circulations. Clear? Now let's see this. You'll find it so easy. This is going what? Right? That one is the brachial artery. This brachial artery dividing, and this is the radial artery, and that is the ulnar artery, and this one is radial recurrent artery, which will be giving anastomosis over here. And this one and these two branches, that is the anterior and the posterior ulnar collateral arteries, right, which will be anastomosing with two other arteries, and this one which is going on the sideways, this is common interosseous artery, and this common interosseous artery, you can see it very finely. This is what we are talking about. That is the artery, and that is none other than anterior interosseous anterior interosseous artery. right? And posterior will obviously be going posteriorly, and we'll see that also. So crystal clear, everything fine. And yes, only our two major candidates which are left out, and they are the median nerve and the ulnar nerve. Ulnar nerve. But they will be supplying all the muscles. Good, right? Almost everything is now known to you. If I zoom it, right, everything is known to you. Yes, this one is musculocutaneous, this one is radial, this one is median, and that one is ulnar, right? And this is brachial artery, that is radial recurrent artery, and this one is common intraosseous artery. These two are anterior, anterior and posterior. They are ulnar recurrent artery, right? And they go down, right? All good. See, just adding bit of complexity to see that what really happens when they go down, right? What we need to see is this. Now, as we said, that here is the median now, and here is the ulnar now, right? So over here, see the network which they make over here, this one, right? They divide and then they join, right? So they are called as the palmar, right? Makes sense, right? Because it is palmar carpal, because it is on the wrist also, palmar carpal branches, right? Branch of it is radius and it is ulna. So palmar carpal branches, these are the branches, right? These are the branches which are going all over, right here. See, these are making the plexuses. Okay. And same thing happens even in case of arteries also, right? See, arteries also divide and they also divide. Nerves also divide. So here it is. See, actually the whole thing looks so complicated, but in reality, it is not that complicated. Correct? We are just adding one more candidate into this. How many structures we know? Well, if we start deciphering it very logically, we know that let's pick them up one by one. We know that this one is nothing but the radial artery, radial nerve. That is the radial nerve. So radial nerve will be giving one deep branch, but this deep is also, it is giving the cutaneous innervation, and this is the superficial which will be going down. Chalo, this is done. Okay. Then there is a musculocutaneous. Well, he has completed his cutaneous muscular parts, only the cutaneous. So once again, it will be giving cutaneous innervations. So that is also done. We are left with only two, that is the median nerve and the ulnar nerve. But then there is something, and we said that yes, this is like lateral cutaneous, lateral cutaneous nerve of forearm. Fair enough. But then where is actually medial cutaneous nerve of forearm? For that, we go back to our brachial plexus, and in brachial plexus, there was the medial cord, and that medial cord, which was giving this medial cutaneous nerve of forearm. And that nerve, long awaited nerve, is what it is now coming over here into this picture. That's the nerve which we are talking about, right? And then it divides into anterior and posterior. So this is medial cutaneous nerve or nerve of forearm, which divides into two parts, anterior branch and the posterior branch. But what it will do, as the name suggests, cutaneous innervations. right? Cutaneous innervation. So done, right? This structure is complete. All those twigs which are shown, they are just the cutaneous innervations, right? See, all good, right? So do remember this, if just for the understanding, that over here it was the lateral cutaneous nerve of forearm. And what was that lateral cutaneous nerve of forearm? It was just musculocutaneous nerves. And medial cutaneous nerve of forearm, and that was from just one, it was from the medial cord. Very important point. Otherwise, rest. So this medial cutaneous nerve complete. That is the radial nerve. Radial is giving superficial and deep. Superficial will travel all the way up to the palm, which will be watching it when we'll be talking about the hand. And rest 3 and 4. So which is left out is medial, right? And so this is median and the ulnar, right? They will be taking their responsibility to supply the muscles further, right? So that's done. Let's see this now. All good, right? You will know all this thing very properly. So just, I'm not writing anything on it. So for the future, right, in case if you want to revise, so you can just freeze frame at this point and you can just identify, right? That would be helpful. Over here, yes, this is also fine, right? Here we tried to emphasize only one thing, and that was the palmar branches. Right? These were like palmar branches, palmar and the digital branches, right? Like this. And what would be the pattern? Yes, it will see it in hand, right? That how this deep palmar arch and the superficial palmar arch would form, right? That will see in hand, because hand itself is a very smart topic individually. So we'll take it separately. Done, right? This one, radial recurrent artery, and this particular nerve, that has to be the radial nerve, and this radial nerve, that is the deep branch, right? And this one would be the superficial branch, and it carries, right? Same way over here, this is radial nerve or artery, and this is ulnar artery, and this one is the brachial artery, and obviously this one, it is ulnar nerve, right? Good one. Over here, right? That's which is going over here. It is the superficial branch of radial, correct? Superficial branch of radial. And one which is over here, I just zoom it. You must see that. Yes. Can you see one which is going like this? And there is one other, it is crossing like this. Right? These two are nothing but posterior and anterior interosseous artery, right? So now we are dealing with the right forearm, correct? We are dealing with the right forearm. Now change the orientation. Now we are watching it from the posterior side. So this means we'll be dealing with the extensor component. And in extensor, there are only few muscles, because even when you look at your forearm, you'll find that there is more bulk on the flexor side as compared to the extensor, right? So just few muscles and immediately you'll come to know that, right? So here it is, this one, right, which was getting seen, that's supinator. That's right, that is supinator, right? So this is supinator. And this one, which is we are watching through that window, that is pronator quadratus. And this one, this deeper one, we said that this is extensor pollicis brevis, the first muscle. As such, we saw this muscle, just a glimpse of it before few minutes, right? But this is extensor pollicis brevis. Adding more. Yeah. So extensor pollicis brevis, and see one muscle which is added over here, right? This is going towards pollicis. Just a minute. Okay. So you have to think now like see the orientation. This is right side, right? Because now, and we are looking from the back, right? So just watch your own hand that you are looking at the back side, right? When you are looking at the back side, right? When you're looking at the back side, it means that this, I am just trying to explain this. There is extensor pollicis, extensor pollicis brevis, which is going for thumb, right? And then the muscle which would be near to it, it will be going for this index finger, index finger. This index finger has got one extra muscle, right? That is specifically for it, and it is called as the extensor indicis. Indices, right? So they are like this, right? So these are the things which you can even watch. You can even watch it over here, right? We'll come to that. But see, these are the deeper muscles. So extensor pollicis brevis and the extensor indicis. Now this is a deeper muscle, right? We know this is a supinator. And this deeper one was extensor carpi radialis brevis because longus was a bigger and it was superimposing it, right? So that is done. So here is all the extensor session. Well, on the other side, through that window, we can see a big muscle. Yeah, it is exactly. It is flexor digitorum profundus, a very deep muscle, but profundus, big muscle. But it is on the other side, right? It is on the opposite side. Okay. Now we add. Yes, now it is fine. So we added this. So this is flexor digitorum profundus, but we likewise we have to just watch. We have to just watch only the portion which is on this side, right? That is the extensor. Okay. So that is flexor digitorum profundus. The way we learned flexors, same way now we'll be learning extensors. We know this part as supinator, so that is completely easy. And on extensor side, we were having two muscles. One was extensor carpi radialis brevis, and on top of it, here it is extensor carpi radialis longus, right? So these are the two muscles, big muscles, right? This has been slightly displaced to see it properly. The third muscle, which is exactly, which is seen over here, so prominent, we are trying to create, yeah, just you move your hand over here, over here, right? So if you can see it, right? Can you see there is a space like this, right? When you, can you see a space like this? the thing what is called as the anatomical snuff box, right? That's what we are trying to create, that where exactly it is formed. So this third muscle, right? This was extensor carpi radialis brevis. So those two are easy. Now this is, which I marked, right? This is abductor pollicis longus. So it means it will be going for the thumb. Cheek, right? So this is the first one. But how it goes, that's what you have to watch. That's what you have to watch. See where it goes. It goes like this, right? Okay. So this is one. So here is another second one, right? Second. So that also goes like this and it comes like this. So if I mark this one and this one, right? So if we take it out, so what are they, right? They are nothing but actually the this is abductor. Yeah, see, abductor pollicis longus, right? So that is abductor pollicis longus. And second one is also going for the pollex, right? That is also going for the pollex. So this is extensor pollicis brevis, short muscles, right? So here they form one group, right? Now see, there is one more over here. This is the third one. So this is muscle number one. Let's clean this. It will become much easier. Yeah. So this is right. This is one. And then this one is two. This one is three. Right. So abductor pollicis longus, that is one. Then we have got extensor pollicis brevis, that is two. And this third one, which is going like this. Again, it is going towards thumb, right? All of them, they are going towards thumb. So this is extensor pollicis longus. So to draw it like this, and this. So when you take your hand like this, right? Your hand like this. So you will find that your thumb, right? Your thumb, right? Over here and here, you'll be able to even feel them, right? You'll be able to feel their tendons, right? You'll be able to feel them. And so this is two, and the space which is created in between, it is called as the anatomical snuff box. Snuff box, right? So in those olden days, they used to put that snuff over here and then they used to smell it, right? But over here, right, it is the abductor. Remember, abductor pollicis longus, then extensor pollicis brevis, and the third one is extensor pollicis longus. So one longus is on both the side and one extensor is on both the sides. Abductor has to be like this because in case of thumb, the rotation, right? When fingers, they flex like this, thumb flexes like this at a 90-degree angle, right? So when fingers, they abduct and adduct like this with respect to this long finger, right? That is abduction, adduction, abduction, adduction. While in case of thumb, it is 90-degree rotated, so it would be moving with an angle of 90 degree. Right? So that's the reason there is a specific muscle given for the thumb part. Okay. So here it is. Now it becomes the extensor carpi radialis longus. This one is extensor carpi radialis brevis, right? And we have one which is abductor pollicis longus. Just trace it, right? It is going all the way. Yes, and this is one. And then there is extensor pollicis brevis, right? So they both will be forming one side of the anatomical snuff box, and opposite side, that is this, that is formed by the extensor pollicis longus. So I'll mark it as 3 because this is 1, 2, and this is 3. This is 1, this is 2, this one is 3, and in between space, that is what is called as the anatomical snuff box, right? Snuff box. Okay. And then this small muscle that is specifically for the index finger, so we'll call it extensor indicis I, right? So that is extensor indicis. When we move on this side, right, over here, right, this one, so we know that this is flexor carpi ulnaris, right? It is the flexor component, right? We don't want that now. So that's why it is a separate one. But over here, right, this is, if that one is flexor carpi ulnaris, so this is on the extensor side, otherwise so everything is same. So this is extensor carpi ulnaris, right? That is good. Extensor carpi ulnaris. Now if you see the muscles which are in the flexor component, they are more powerful as compared to the extensor, right? So extensors, they are relatively weak, right? So that's why their bulk would be bit less. Over here, this is extensor digitorum, right? That would be extensor digitorum. Yeah. Now see the complete set, right? Extensor carpi radialis longus, extensor carpi radialis brevis, right? The complete set. Then this is extensor digitorum in full way, right? Complete one, right? Full complete. Over here, just eliminate this, right? It is only a small twig, so let's remove this. In fact, this is for just one small finger, so I would like to name it as mini-me, right? Let's write it mini-me. Mini-me means it is just for that little finger, this extra piece is going. I'll highlight it. I'll highlight it. This one, this one, this one, this one, this one, just like this, right? In fact, importance of this would come when we'll see the hand, right? Because these are the muscles which are for finger, little finger, or thumb, etc. Okay, the bigger muscle, full extensor digitorum, the actual one, bigger one for all the fingers, right? It has got, see, so many sleeves, right, for the fingers. So extensor digitorum, so that's good. This is this one. And finally, which is on the side, that would be extensor carpi ulnaris, because this one is flexor carpi ulnaris, right? So they are the flexor and extensors. Okay, so this is done. Over here, now these anatomical snuff box, they are a bit hidden, so but we know their names. They are abductor, they are abductor pollicis longus, extensor pollicis brevis, and this small chupa hua, right? This one, right? That one would be extensor pollicis longus. In between is anatomical snuff box, right? Okay, let's see over here. All good, right? This would be for your practice, right? This would be actually for your practice because all the muscles we have described. So if I randomly take that which muscle is this one, which muscle is 2, and which muscle is, let's say this one, 3, right? Just 1 minute. Write down the answers. Which one is 1? Which one is 2? Which one is 3? Right? This one is extensor digitorum, digitorum, right? This one would be, so starting with this, extensor carpi radialis brevis, right? This one would be extensor carpi radialis longus, and this last one, so it is that brachioradialis, right? So powerful, big muscle, brachioradialis, that is getting seen. So this one is extensor carpi radialis brevis. That's extensor digitorum. Yes, this is for that anatomical snuff box. It is extensor pollicis brevis. So then where is longus? Here is the longus, right? Here is the longus. Okay, that is extensor pollicis longus. And yes, this one finally is none other than extensor carpi ulnaris. All good, right? This is for your practice. You can just go through all these muscles, right? This one is flexor carpi ulnaris, right? And rest of the all 4. So moving further, here we have removed one muscle, right? That is, or just see, this is extensor digitorum, right? And we have removed extensor digitorum over here so that we can see the muscles which are just underneath. And that's where we see those muscles of, say, antral snuff box properly. So this is abductor pollicis longus, and over here this is extensor pollicis longus, and this one is extensor pollicis brevis, right? Those things, they are seen clearly. And see, this one is extensor indicis, index finger, right? That small one. These were covered by ed, extensor digitorum. We removed it so that they can be seen clearly. Let's move further, right? We removed some more muscle. We removed, see, extensor carpi ulnaris. Where was it? This one, right? It was extensor carpi ulnaris, right? And this thin one was extensor digiti minimi. We removed that, right? We removed both of them. So we removed extensor carpi ulnaris and we removed extensor digiti minimi. So that is removed. Even we removed this flexor carpi ulnaris, right? Which was giving a bulk over there. So we removed that. It means now we have left with those final muscles. This one, it is extensor carpi radialis longus, extensor carpi radialis brevis, right? These two, correct? And then that one is the now known supinator, and these lower muscles, so they are all known to you. 1, 2, so this is very musical, abductor pollicis longus, one longus, so then there has to be brevis. All are for pollicis. This is extensor pollicis brevis, and then this one is extensor pollicis longus, done. And this one, it is extensor indicis, right? Indicis. And finally, only the last layer, right? That is the supinator is there. This is extensor carpi radialis brevis. This is flexor digitorum profundus. Almost the bones are there, right? See, this is extensor indicis because we removed that extensor pollicis longus, right? So that we can watch that pronator quadratus, and this one is extensor pollicis brevis, right? We removed even abductor also. And finally, this is supinator, right? And the pronator quadratus. and the extensor pollicis brevis, the lone last warrior, right? And finally, ulna and the radius, right? So back to our bones, right? So this was the journey all the way from bone to bone, right? These muscles, right? For these muscles, you should be having a visual memory, right? So watch these muscles, right? Few of the images on which nothing has been marked, and just try to identify that which are those, right? And for arteries and nerves, the best for arteries, so that you draw that, you must have drawn along with me, right? So do that practice, right? And for nerves, you have to just understand it, right? Four nerves. So radial completed its part, musculocutaneous that also completed, and only thing, median and the ulnar nerve, they will be playing their roles in the hand, right? So see you next week when we'll be dealing with hand. And as I said, this was forearm part 1. That means, will there be forearm part 2? Yes, otherwise I would have said forearm, right? Just forearm. So it would, this was forearm part 1. Next time we'll take hand part 1, and then we'll combine both of them, that is the forearm and the hand part 2. So which will give complete understanding. This was just the foundation, then we'll be adding some more structures, and that's how we shall complete, right? So thank you so much, and see you very soon. Bye bye.